Hey guys, this is Dr. Bert. This will be our second installment with case studies. We were approached by a patient of ours who actually has moved away to North Carolina. We're still in communication, and when she comes home to visit friends and family, she comes in and gets treated. And while in North Carolina, she had some accidents hiking and running, some falls, and then started having some discogenic symptoms. So while she was in town, we treated her, and we've been able to help decrease some of those discogenic signs and symptoms. However, she still does have low back pain, some with long hikes, with long runs. She's an ultra runner, so she runs a ton, and would love to get back to those daily activities. And recently, she emailed us to troubleshoot some things. She said when she's hiking with poles, it does help her low back. However, it does increase the pain between her shoulder blades, and it does increase the tightness in her hip flexors and in her QL. So instead of trying to get real technical in an email, I thought we would shoot this video specifically for her and maybe for anyone else that might be looking for some tips and tricks relative to mid-thoracic mobility, QL, and psoas tightness. So here we go. So Leah, this is for you. The first thing we're going to do is talk about two tennis balls taped together. It forms a small cleft where we're going to lay on our back. We're going to put our spine in the middle of that cleft and use this for mobility exercises in our mid-thoracics. Leah says that when she's using poles and hiking, that it irritates her thoracic spine. One of the things I'm thinking is that she really just needs to focus on mobility in the thoracic spine. If you don't have motion, you can't use motion, and you're going to develop irritations in those areas. So gaining mobility is huge in anything that we do, from waking up and getting dressed to high performance activities. So I'm going to show you how to use this. We're going to lay on our back. We're going to put our spine in this cleft. And what that looks like is in the area of complaint. We're going to put the two tennis balls on the sides of the spine with the spinous processes, or those little bitty bones, right in that cleft. We're going to concentrate on extension or laying on our back. And we're going to concentrate on bringing our spine into the floor or into a table. So what we're going to do is we're going to push our back into the table while we try to get our head flat on the floor. And that's going to create a fulcrum for us to go into thoracic extension. You can scoot down, continue that mobility with just trying to push your spine into the table while trying to keep your head on the back on the floor. You can also reach overhead for an increased long lever over that fulcrum. It really helps to torque and just to really increase that stretch in the thoracic spine. You can also add weights, as much as a soccer ball or as much as like a weight. This is a 10-pound weight. You don't need a lot. Anyone who's done this will tell you. But just using that weight to really just force us into some good thoracic extension. So work over your spine at every segment where you feel really tender. Don't overwork it, okay? So we want to oscillate in and out of that position, like we're working a hinge or we're working that spinal joint, okay? So this is a tennis ball trick for thoracic mobility. Another thing that you can do, use a soccer ball. We have a med ball or any kind of a basketball works great. Anything where you can replicate that activity, where we're just coming into thoracic extension using this as a fulcrum. And we just want to hang out in those positions, barring that there's nothing going on with your arteries in your neck, or there's no, major pains in your neck when you're doing this. You just want to go into thoracic extension and just kind of oscillate over this, just trying to, again, just work those joints. This is a little less aggressive. You can move into things that are more aggressive, such as the thoracic foam roll. You're going to do the same thing. Again, we're just going into thoracic extension. With the foam roll, it's just so versatile. We're going to do several different things on the foam roll. Just rolling through the thoracic facets is going to be great for increasing the mobility in that area. We have other YouTube's clips that show this as well. You can do thoracic extension. You can do side lying, rotation, and extension over the roll to increase the mobility between the vertebra in your thoracic spine. Okay, so again, we're side lying, we're rotating, and we're going into extension over the foam roll. Okay, we're going to do that in multiple positions just to kind of open up the ribs, really stretches some of the intercostals, even into the QL as well. These are all going to be great for that mobility between the scapula, between the mid-thoracics. Another way to use the foam roll is to do punch-and rolls. Okay, so punch-and rolls, you're going to lay with your butt and your head. Your spine is completely on the roll. Get a wide base with your feet because it's going to be kind of rocky or slippery. You're going to punch up while rolling to your side. We're using this arm to keep us safe from rolling all the way off. You're going to punch up. You're going to roll to the opposite side and punch up. Again, this just helps to increase the mobility in our thoracic spine. Again, I can't stress that enough. The more that you're working on thoracic mobility, the less you'll hurt when using your poles while hiking. Okay, some great stuff on the foam roll there. You can check out our YouTube channel for other foam roll tricks. Also, don't forget snow angels. We want to lay on our back. Everybody forgets to do their snow angels. Everything stays flat. Your wrists stay flat. Your hands stay on the ground. Your elbows stay flat. Don't let anything come off the ground. You want to start with your knees bent. Start with your hands palm up by your side. You're just going to work through a full range of motion like you would in the snow, all the way up. Don't let your elbows come off. Don't let your hands come off. And don't let your wrists break. Try to keep everything flat. When your hands come together, you just want to push straight up over your head. And you just want to repeat that, okay? This is your snow angel. Does a great job of stretching everything in the anterior portion, the lateral portion of your arms, your lats. It also strengthens your rhomboids and your posterior musculature, and it also increases our thoracic extension as well. So people neglect this simple exercise. Man, this is like brushing your teeth for your spine. This is an amazing little trick, okay? So don't neglect the foam roll. Or, don't neglect snow angels. We did the tennis ball, we did the foam roll, punch and rolls, hook line rotation. Now we're going to get into what's called side lying extension. So we're going to lay on our side almost like we're watching TV laying on our side. Our knees are bent, our feet are on top of each other. We're going to turn and almost do like a cobra or do like a press up. We're really focusing on stretching between the ribs, stretching your transverse abdominis, external obliques. We want to just really get into a lot of good extension, really just feeling a good stretch into that QL, into all these side lateral muscles, even in between the ribs, really just trying to get tall. We're going to swap the other side. Really just the outside arm is where most of my pressure or overpressure comes from. You really don't need this arm, but we're just really trying to work into some good extension. Just again, opening up all these areas that are so tight while we're hiking with our poles, right? So again, that's the focus here. This is amazingly painful, but really effective. You can grab a kettlebell of any size, it doesn't matter. And we're gonna get the handle of the kettlebell into our QL, transverse abdominis, external obliques, and even deeper into our iliacus and our psoas, okay? Super, super not fun, but really productive, okay? We're gonna get that kettlebell, and shout out to Kelly Starrett. Kelly does a great job. Go to Mobility WOD and look at a lot of his mobility exercises. He's got a lot of great tricks and tips for how to do self-mobilizations, self-releasing of all these different muscles. So a lot of what I've learned is just from looking at his books and his videos as well. So again, what we're gonna do, get the handle right into that area, right on top of that hip bone or the iliac crest. We're just gonna relax into that area. Feels pretty gnarly. Breathing just nice and gentle into it. Let your body kind of relax into that. You can use your elbows to kind of offload that. The further out, your elbows get, the worse it feels, or the more aggressive the stretch. You can even get your leg into flexion, your lower leg into flexion. You can work it in and out of internal rotation, external rotation, and just really just goad that tissue with your own body weight. Feels super nasty, but it's really productive. Go to the other side, do the same thing. Again, just letting your body, the weight of your body just hang out in that position. It's gonna be really good, okay? Try these at home. Let me know how things go, and we'll follow back up with you when you're back in town. Have a great day.